The ductus arteriosus is a temporary vessel that is used during in utero life. It shunts blood from the pulmonary artery into the systemic circulation because the pulmonary circulation is not needed during this time. If it does not close at birth, the patient ductus arteriosus is a result. After birth, the ductus arteriosus must close quickly in order for the vascular system to develop into the matured split pattern of arteriovenous circulation. Failure of ductus arteriosus to closure, also known as a patent ductus arteriosus or PDA, is a primarily a disease of prematurity. With the ductus remaining open around at 7 days of age into up to the 64% of a neonates born at 27 to 29 weeks gestation, and in 87% of infant born at 24 weeks. There are uncertain etiology regarding the cause of patent ductus arteriosus, but the patent ductus arteriosus is always continue after the first 24 to 48 hours of a newborn life. Premature birth raise the risk of patent ductus arteriosus due to the psychological variable associated with preterm. Rubella injection during the pregnancy may potentially be a factor in a rare situation. The patent ductus arteriosus is also can be related with the chronic heart disease, such as especially in the etiology. The etiology of the congenital heart disease include the inherited genital disorder, chromosome aberration such as Down syndrome, and environmental factors such as alcohol, drugs, infection, radiation, and maternal disease. So it's related between the chronic heart disease and patent ductus arteriosus. Infant with patent ductus arteriosus generally have a heart murmur and display cyanotic features resulting from the shunting. This is happen because the left ventricle contracts with more force compared with the right ventricle. Arterial blood within the aorta shunted into the pulmonary trunk via the open ductus arteriosus. Instead, it go out into the systemic circulation. This will increase the volume of blood propelled into the lungs, and also this increase pulmonary vascular congestion and the volume of blood returning to the left atrium. The other complication regarding the left to the right shunt is responsible for many of the effect of the patent ductus arteriosus. Respiratory failure may be exacerbated by the pulmonary edema, which is brought on by hyperperfusion of the pulmonary vasculature. Bounding pulses brought pulse pressure, compensatory ventricular hypertrophy for systemic hypoperfusion, murmur, especially in a newborn, and unexplained metabolic acidosis are all symptoms of the persistent patent ductus arteriosus. The low diastolic pressure affect the circulation to pressure sensitive organ like the intestine, muscles, kidneys, brain, and skin, as well as the hypotension and systemic hypoperfusion. In accordance with the organ impacted, hypoperfusion may result in causes of intraventricular bleeding, NEC, feeding intolerance, and renal failure. There are a lot of procedure to diagnose the patent ductus arteriosus, but in this slide, I show the 3 procedure that common used in the diagnose or in the investigate for the patient that have patent ductus arteriosus. The procedure include, the first one is the chest x-ray, the second one is the CT scan, and the last one is the echocardiography. The first step or the common procedure to investigate the patent ductus arteriosus is a chest X-ray. The chest radiograph may show cardiomegaly with enhanced pulmonary vascular marking, or it may be perfectly normal depending on the amount of the ductal shunting. The major pulmonary artery is frequently enlarged, and calcification of the ductus may be visible, especially in elderly person with the pulmonary hypertension. The diagnosis of patent ductus arteriosus in preterm newborn with hyaline membrane illness relief very minimal on the chest radiography. Mechanical ventilation, the level of acidity, and the hypoxia and the cardiac size are all vary. The size of liver is also determined by the radiograph. Was of a little use in our series since pulmonary edema might be hidden by hyaline membrane disease and other lung condition. So for investigate the patent ductus arteriosus, the chest X-ray is not suitable because it cannot demonstrate, or it cannot show the evidence of the visible of the ductus arteriosus. So generally the chest radiography just shown the size of the heart. So sometimes the radiologist can see the evidence of the cardiomegaly that can be determined as a patent ductus arteriosus. So for more investigation regarding the patent ductus arteriosus, they must have another series of procedure to conclude or to investigate more regarding the patent ductus arteriosus. Computed tomography or CT scan is a non-invasive modality used to assess cardiac and vascular disease. Multi-detector scanner provide the best or the highest image quality in an electron beam. CT may also be used to image the heart. The computed tomography also can evaluate the level of calcification in the adult with the patent ductus arteriosus, which may be crucial in surgical therapy is being considered. A chest computed tomography scan with contrast reveal multiple pulmonary nodules, some with cavitation consistent with septic pulmonary emboli, and a hypodense mass indicative of vegetation adhering to the main pulmonary artery and the proximal left pulmonary artery. Due to the either left pulmonary artery mass impeding patent ductus arteriosus flow or technical issue with the echocardiography. The PDA was seen on the CT, sometimes was not visible on the echocardiogram. Also, the image in CT scan can during construction until the evidence of patent ductus arteriosus are visible. As we know, the CT scan images can be viewed with coronal view, sagittal view, and axial view. This will help a radiographer or the cardiologist or the doctor to evaluate or to find and then to confirm the evidence of patent ductus arteriosus. The next and the gold standard for the investigate the patent ductus arteriosus is this echocardiogram. The preferred procedure to confirm the diagnosis and define a patent ductus arteriosus is an echocardiography. The echocardiography is frequently helpful in categorizing the patent ductus arteriosus as silent, small, moderate, or large in conjunction with the clinical data. The echocardiography is used to find and assess additional associated heart abnormalities in addition to assessing the ductus arteriosus. M-mode echocardiography is used to quantify or to identify the left ventricular systolic performance and assess the diameters of the heart chambers. In patients with a small ductus arteriosus, chamber size are usually normal, although mild left atrial and or left ventricular enlargement may be present. In a patient with a moderate or large patent ductus, the left atrium and the left ventricle are enlarged. Two-dimensional imaging demonstrates the geometry of the ductus. In this echocardiogram, the color Doppler is very sensitive modality in detecting the patent ductus arteriosus and is frequently used to estimate the degree of the ductal shunting. Even an extremely tiny patent ductus can be detected by a color flow signal entering the pulmonary artery near the origin of the left pulmonary artery. In patients with the high pulmonary vascular resistance and patent ductus arteriosus with low velocity or right to left flow, the ductus arteriosus may be very difficult to demonstrate with color flow Doppler, even the patent ductus arteriosus is large. So how the patent ductus arteriosus can be seen or can be visualized in the radiography image or in the CT scan or in the echocardiography. So let's see first the first image. This is the chest x-ray for the patient that suspect with the patent ductus arteriosus. From the radiograph, we can see the enlargement of the heart that we call the cardiomegaly. You can see the heart is enlarged, is bigger than the normal heart. And then from the radiograph, we also can see the another anatomy such as apex of lung, the scapula, the aorta, the heart, the body vertebra, and the costophrenic angle, the hilum marking, ribs, and also the clavicle. So from this radiograph, the evidence that we can see is just the enlargement of the size of the heart. So for the further investigation, another procedure is need rather than the chest x-ray, because like I said, the the evidence to visualize the patent ductus arteriosus is not suitable for chest x-ray. The next image is the sample of a slice from the CT scan. So from the image, we can see the structure of the thoracic mediastinum. Okay, we can see the body vertebra, and then we can see the descending aorta. You can see the lungs, both lung, right and left lung. You can see left pulmonary artery, ribs, sternum, aorta. We also can see the evidence of the superior vena cava, the esophagus, and the scapula. So from this image, it can determine, or it's shown the evidence of the patent ductus arteriosus, like it can be shown in this image. You can see the patent ductus arteriosus around, or it connect to the left pulmonary artery and the descending aorta. And then from this radiograph, we also can know the procedure is also use contrast media. It can be evident. It can be demonstrated, or it can evidenced by the whitening around the whitening that fulfill the structure. So that means the media contrast help to enhance the the image and also the region of interest that we want. And with the middle contrast, we also can see the evidence of the patent ductus arteriosus at the left pulmonary artery and the descending aorta. So the last one, we will see the image from the echocardiogram. So how patent ductus arteriosus demonstrate in the echocardiogram. So from this image, we can see the image of the heart chamber. You can see the right ventricle, you can see the aorta, the pulmonary artery, and then the descending aorta. We also can see the color. That means this patient have already undergo the Doppler, the color Doppler. As we know, the color Doppler will show the color around the flow to make sure to demonstrate or to evidence the flow of the blood okay. And then we can see around the flow the pathway of the patent ductus arteriosus is evidence in this radiograph. Alright, so like I said, the echocardiography is the gold standard to determine or to demonstrate the patent ductus arteriosus. It is include if the patent ductus arteriosus in small, is a medium, and in a medium size, or in a large, or in the larger size of the patent ductus arteriosus. Commonly, the patent ductus arteriosus patient are children, or sometimes the neonates, and sometimes the baby that are premature. So there's a considering regarding the technique. So how to proceed, how to make sure along the examination, along the procedure can go smoothly and can provide the good image to detect the patent ductus arteriosus. So the best technical considering is the regarding briefing to the pediatric patient. To optimize the probability of the successful examination, parents should be given a clear and a description of the examination and ask the parent to discuss with their kids. This will help the kids understand, and the parents also can understand the procedure along the procedure. With proper X-ray protection, the parents may be allowed into the procedure room to accompany the patient along the procedure. But some of the patient, especially neonates and extremely small infant, maybe cannot maybe it's hard to control along the procedure. And there's a lot of strategies, such as the give the sedation, and or without a sedation, the patient can also support with the immobilizer, or wrapping in a blanket, or other means of immobilization to prevent motion artifact. So to produce the good image, to prevent the motion along the procedure, to make sure the image that we have can demonstrate the patent ductus arteriosus, the movement of the patient must be controlled. So the helping from the parents, especially the parents, can reduce the percentage of the movement from the patient. So my technical consideration is regarding the briefing of the pediatric parents.